Disc herniations are a very prevalent condition across the country. And today we're going to talk about lumbar disc herniations and how they can affect your low back and how they can affect your leg. And today with me I have a jelly bun, which I am going to use as a demonstration for a disc herniation, because a jelly bun is actually kind of like the discs in your lower back, in that it has an outer layer, which is the donut part, and on the inside it has jelly. We all have eaten a jelly bun, so we know what I'm talking about. Well, in the spine and the discs between the vertebra, these white structures right here, okay, kind of resemble a jelly donut, because inside this outer layer is a little gel-like material called the nucleus pulposus, which is the part that gets herniated when you tear through the outside layer. So let's demonstrate how that happens with the jelly bun, okay? But before I give you the pleasure of seeing me dive into a jelly bun and getting white stuff all over my face, I want to talk to you a little bit about when disc herniations occur, okay? Because they can occur several different ways. Number one, they can occur over a period of time. So sitting at a computer desk, driving a lot, occupations where you're in the car or a truck for a long period of time, or you're sitting at a desk at work, this is what happens to the disc in your back, okay? When you're sitting, the front part of the disc, focus in here, the compression in your lumbar spine forces the front part of the disc into a wedged position. As you can see, the front part of the disc is flattened and the back part of the disc remains high with the fluid in it. So, but all of this pressure pushes the fluid inside the nucleus pulposus towards the back of the disc. More often than not, the back of the disc becomes weak, and over a period of time it becomes so weak that the disc material from the inside actually will break through the outer wall. Now when it breaks through the outer wall, you will actually experience back pain. When it breaks through the outer wall and it pushes on nerve roots that come off of your spinal cord down into your leg, if the disc comes out and presses on one of your nerve roots, this is when you experience leg pain. Sometimes you can experience numbness and tingling. So many times people that have aching and pain in their legs and even numbness and tingling into their legs can actually be a disc herniation. When you might think you have a leg problem, it actually could be a disc herniation, and many times it is. In my practice as a physical therapist, I see it all the time. It's very, very common. So let's show you what the disc does when it ruptures. I don't usually eat donuts for a living. I'm actually big on fitness and good nutrition, but I have to give kudos to Holland Farms because they do make a great jelly bun, and they do make for a great demonstration of a lumbar disc herniation or a cervical or thoracic disc herniation as well, which is your upper back and your cervical spine and your neck. Okay, so this is what happens. Focus in on this jelly bun here. When the outer layer breaks open, the disc material leaks out, okay? And what happens with that disc material, as I showed you before, compresses on a nerve root. If you do in fact have a lumbar disc herniation, it is very important to find out sooner than later. And there are some red flags that I'd like you to know about and that you should keep your eye out for, because if you do have any of these red flag symptoms, you need an examination pretty quickly. True weakness in one or both of your legs is an indication that there could be a disc herniation and compression on a very vital nerve root. If you have numbness in your groin, something that we refer to as saddle anesthesia also needs prompt attention. If you are losing control of your bowels or bladder, you need to see your family physician immediately. If you have any unexpected weight loss. And this is what we call multi-level disc herniations. All jelly buns and red flags aside, the good news is most disc herniations can be treated successfully in physical therapy using specific techniques. Here at Function Better Physical Therapy, we have McKenzie spine-trained physical therapists that use techniques that are very successful at getting rid of the symptoms and the complications of disc herniations. Spinal stenosis is a degenerative spine condition, a narrowing of the spinal canal, and is the primary reason for surgeries on the spine in people over age 65. So, what are our choices with spinal stenosis? What can we do? What can't we do? You really have three choices. You can do nothing, you can try a conservative approach like physical therapy and some other modalities, or you can have surgery. The idea is to decompress the spine and take care of the complications that occur because of spinal stenosis. What happens in spinal stenosis is you see the spinal cord, how it traverses all the way down through the central part of the bones, your vertebra, these are the backbone. The spinal cord travels through this canal, and with spinal stenosis, there's bony growth inside the canal which leads to a narrowing. And what happens is when the spine moves with a narrowed canal, it causes compression on the spinal cord. And when you compress your spinal cord, many different things can happen. Severe things, mild things. For people who are suffering from spinal stenosis, it's not as easy as going into a physician's office, a physical therapist's office, or even a chiropractor's office and expecting to come out without pain. A spinal stenosis is there to stay. We have to learn to manage it. The only way to manage spinal stenosis conservatively is to identify exercises that open up the spinal canal. So you'll often see when you go into a physical therapy program, many of the exercises are flexion related. Laying on your back, bringing your knees towards your chest. You obviously don't tolerate lying on your tummy or standing and walking for prolonged distances. I believe one of the best approaches to managing spinal stenosis is to pay attention more to the complications of spinal stenosis and not necessarily the pain and the symptoms that you're feeling. Many times we can't do anything with the pain, or we can do limited amounts with the pain that you're feeling and the numbness and tingling into your legs. But what we can focus on is keeping you functional longer in life. You see, because what happens is with spinal stenosis, you get so much pain and numbness and tingling and weakness in your legs, and you can't go shopping or walking for prolonged distances. So what do most people do? They sit home on their couch, watch TV, and do nothing. The problem with that is everything else in your body starts to shut down. Your cardiovascular system, you can get blood clots just sitting doing nothing. You're not staying mobile, so your joints are freezing up. They're becoming more stiff, and your your muscles are becoming weaker, and you're not climbing stairs. You're not going out to the car. You're not going out into the community. So here at Function Better, the first thing we do is identify whether you have spinal stenosis or not. Now, there are two types of spinal stenosis. There's primary and secondary. Primary is where you actually have bony narrowing and the spinal cord is being compressed because of a structural problem. There's a secondary stenosis, which we talked about earlier, disc herniations. Now, if a disc is herniated, that material can in fact go out into the canal and cause a stenosing of the canal, but we may have the ability to get that disc material back out of the spinal canal, and many times we do. So the first step is examining you and finding out what type of spinal stenosis you have, if you have spinal stenosis, and then making a treatment plan from there. First, we focus on symptom resolution. If we can't take away your pain, then we move on to the strength and flexibility program that can loosen up your joints, stretch your muscles so that there's not undue stress on the back, and we teach you strategies to avoid positions and activities that can exacerbate your symptoms and help decrease your function rather than increase your function. You need to work with a physical therapist to find out what your tolerance level is in terms of activity, because too much activity can be bad for your condition. That's why you need a licensed expert to help take you through a custom program for your particular spinal stenosing condition. In cases of severe spinal stenosis, or in cases that cannot be managed with conservative care, most likely after a 3 to 6 month period, surgery can become an option. What are some signs of spinal stenosis that could indicate that you have the condition yourself? Sitting is your most comfortable position. Walking a distance makes your legs feel absolutely exhausted, and you have to sit to relieve it. You're unable to lie on your tummy or stand for prolonged periods of time. You have to lean forward on the cart while grocery shopping. Stick around, because when we come back, we're going to meet a gentleman that came to me for low back pain, and was he in for the surprise of his life when we come back.